జబ్బు వచ్చిన తర్వాత ఆసుపత్రికి వెళ్లడం కాదని ముందు నుంచి ఆరోగ్యాన్ని కాపాడుకోవడమే ప్రతి ఒక్కరి లక్ష్యం కావాలని అమెరికన్ మెడికల్ అసోసియేషన్ అధ్యక్షుడు డాక్టర్ బాబీ ముక్కామల సూచించారు. గుండెపోటు వచ్చిన రోగికి చికిత్స చేయడం కంటే గుండెపోటు రాకుండా నివారించడం తేలికని తెలిపారు. ఆరోగ్య సంరక్షణకు తన వంతు సహకారం అందిస్తామంటున్న A.M.A అధ్యక్షుడు E.N.T. వైద్య నిపుణుడు డాక్టర్ బాబీ ముక్కామలతో ప్రత్యేక ముఖాముఖి ఇప్పుడు చూద్దాం.
వైద్య రంగంలో ప్రపంచంలోనే అత్యంత ప్రతిష్టాత్మకమైనటువంటి సంస్థ అమెరికన్ మెడికల్ అసోసియేషన్. దాదాపు 178 ఏళ్ల సుదీర్ఘ చరిత్ర కలిగినటువంటి సంస్థకు అధ్యక్షుడిగా ఎన్నికవడం అంటే ఒక అసాధారణమైనటువంటి గౌరవం. అలాంటి ఘనత దక్కించుకున్న మొదటి భారతీయ సంతతి వైద్యుడు, మన తెలుగు మూలాలున్న వ్యక్తి డాక్టర్ బాబీ ముక్కామల. A.M.A 180వ అధ్యక్షునిగా కొనసాగుతున్న డాక్టర్ బాబీ ముక్కామల E.N.T. వైద్యులు మాత్రమే కాదు, సామాజిక బాధ్యత ఉన్నటువంటి నాయకులు. అమెరికాలో వైద్య సంస్కరణల కోసం ప్రస్తుతం ఆయన పోరాటం చేస్తున్నారు. ఇటీవలే ఒక క్లిష్టమైనటువంటి బ్రెయిన్ ట్యూమర్ శస్త్రచికిత్సను జయించి ఒక రోగిగా తాను పొందినటువంటి అనుభవంతో వైద్య వ్యవస్థలో మరింత మానవీయతను తీసుకురావడానికి కృషి చేస్తున్నారు. AI వంటి నూతన సాంకేతికను వైద్యులు ఎలా ఉపయోగించుకోవాలి, భారతదేశం అమెరికా వైద్య విధానాల మధ్య వారధి ఎలా నిర్మించాలి అనే అంశాలపై మనతో మాట్లాడేందుకు డాక్టర్ బాబీ ముక్కామలు ఉన్నారు. ఆయన అడిగి మరిన్ని వివరాలు తెలుసుకుందాం. సార్, కంగ్రాచులేషన్స్. A.M.A అధ్యక్షులుగా ఇండియన్ హారిజన్ నుంచి వెళ్ళి తెలుగు వ్యక్తి కావడం. సో మీరు A.M.A అధ్యక్షులుగా ఎలా?
చాలా ఎక్సైట్మెంట్ వచ్చింది నాకు. మా నాన్న ఇండియా నుంచి USA వెళ్ళారు. అక్కడే కాలేజ్, మెడికల్ స్కూల్ అక్కడే చేశాను. USAలో 10% డాక్టర్స్ ఫ్రమ్ ఇండియా. అందుకే నేను ఫస్ట్ డాక్టర్ A.M.A ప్రెసిడెంట్ ఫ్రమ్ ఇండియా. చాలా సెలబ్రేషన్ నా కోసం కాదు, భారత్ కంట్రీ కోసం హ్యాపీనెస్ వచ్చింది.
సో యాజ్ A.M.A ప్రెసిడెంట్ మీ ముందున్న ప్రయారిటీస్ ఏంటి?
Health care in the United States needs much improvement. Right? We spend more than anybody in the world, $4.5 trillion every year spent on healthcare. So we need to improve health because we spend so much. So that's why our goal as the doctors in the American Medical Association is to improve the health of America, but not spending more money, but spending the money properly.
సో AI ఇంటర్వెన్షన్ మీరు ఎట్లా దాన్ని సమర్థిస్తారు? అలాగే ఫ్యూచర్ లో AI అనేది డాక్టర్లకి రీప్లేస్మెంట్ ఉంటుందా, డాక్టర్స్ హెల్పింగ్ గా ఉంటుందా?
AI, most people call artificial intelligence, but A.M.A doesn't call it artificial intelligence. We call it augmented intelligence. So augmented intelligence means that we are improving the doctor's ability to take care of their patients. But we don't want that to be a computer company that makes some product that sells it to doctors to then take care of the patients. We need to be involved in creating the technology. So doctors' involvement in producing augmented intelligence will improve healthcare in America and the world.
AI ఇంటర్వెన్షన్ పెరుగుతున్నప్పుడు పేషెంట్కి సంబంధించినటువంటి ఇండివిజువాలిటీ, వాళ్ళకి సంబంధించిన ఈ టెక్నాలజీ ఇంటర్వెన్షన్లో వాళ్ళ కేర్ ఎలా ఉంటుంది?
The AI will help us to take care of that patient. So for example, in the US, if somebody lives in one state and they come to see a doctor in a different state, there's no reason to repeat the testing, repeat all of these things for the patient. We should be able to use AI to see exactly what the history was, right? And so that's why it will help us to take care of our patients. They will get better care because of AI, but it has to be done properly.
సో వరల్డ్ వైడ్ AI ఇంటర్వెన్షన్ వచ్చిన తర్వాత ఎలా ఉంది సార్ సినారియో? ఏ విధంగా ఉంది? AI కంట్రీస్ లో AI ఇంటర్వెన్షన్ చాలా ఫాస్ట్ గా ఉంది అనుకోవచ్చు.
Yeah, so when AI started in the USA, 50% of doctors were scared. Now majority of doctors are excited about AI, but there's still fear. So it's moving in a direction where we're more comfortable using AI.
AI రోల్ ఎంతవరకు ఉంటుంది పేషెంట్ కేర్ లో?
ఇప్పుడు maybe 50% of doctors in the USA use AI to some degree, right? So some extent. Not everybody, but sometimes we use it. For example, I use it when I'm writing my notes in the office when I see a patient. AI helps me to document the questions that I ask. Other places AI can help with procedures. Right? AI can help with pharmaceuticals. So it's very useful, different for different doctors.
ఫస్ట్ టైం 2026లో CPTకి సంబంధించినటువంటి నోట్ కూడా AI దాంట్లో రావడం జరిగింది. ఇది ఎలా టెక్నాలజీని మారుస్తుంది?
Now that there's coding available for AI, now we can document better exactly what we did. Right? So CPT coding is common procedural coding. So when we use AI, we should be able to have a specific code for this new use. We don't want to use some old code for new technology.
మీరు A.M.A కి ఇండియన్ హారిజన్ గా ఫస్ట్ ప్రెసిడెంట్ గా ఉన్నారు. ఇండియాలో చూస్తే చాలా తక్కువ ఖర్చుతో ట్రీట్మెంట్, లో కాస్ట్ తో ట్రీట్మెంట్ అనేది ఉంటుంది. అమెరికాలో టెక్నాలజీ ఇంటర్వెన్షన్ ఉంటుంది, కాస్ట్ ఎక్కువగా ఉంటుంది. సో ఈ రెండింటి మధ్య వేరియేషన్ ఎలా చూస్తారు?
I think that both India and the US are great at some things and need to improve in other things. But instead of India trying to do it by itself, instead of the US trying to do it by itself, I think there's an opportunity for us to learn from each other, right? So that's why I came to India with other board members of the American Medical Association, so we can all see healthcare in India, learn from it, help the healthcare in India by giving whatever advice we have, but also observing things that we can use when we go back to the United States to improve the healthcare there. So coming to India has been very educational to see how do we take care of 1 billion people and need less technology to do it and to still do it well. And so those lessons we can learn, but in the same way, we can talk to the people, the doctors in this country to tell them what we're doing, that they may also consider changing here. So we both learn.
ఏ అంశాల మీద ఫోకస్ చేస్తున్నారు మీరు? ఇంటరాక్షన్ విత్ డాక్టర్స్ కావచ్చు, పేషెంట్స్ కావచ్చు, ప్రధానంగా ఏ ఇష్యూస్ మీద, ఏ టైప్ ఆఫ్ డిసీజెస్ మీద ఫోకస్?
Yeah, so AI I think is very useful for so many diseases. Everything from surgical disease, but I think more importantly, just the primary care, the basic care of health. Because I think even in this country, even in India, we spend so much because we only call the doctor when something goes wrong, right? I think we should do a better job of preventing the disease. For example, if you have stage 1 high blood pressure and you don't find out about that, by the time it becomes a problem, you have stage 2, stage 3 high blood pressure, then you have a heart attack or you have a stroke. Then you see the doctor, then you go to the hospital. But that's not a good investment in healthcare. So even in the USA and even in India, I've noticed we need to make a better investment in prevention of disease. So one, we don't have to spend as much money because we prevent the stroke. So our goal should be to preserve health, not just take care of people after they get sick.
మెయిన్గా చూస్తే ఇటు ఇండియా కావచ్చు, ఇటు అమెరికా కావచ్చు, ఇటు డయాబెటిక్, హార్ట్ కేర్ సంబంధించినవి, క్యాన్సర్, ఇవి చాలా వరకు చాలా ఎక్కువగా ప్రివేల్ అవుతున్నాయి. సో మెయిన్గా ఎలాంటి ఇష్యూస్ బోత్ కంట్రీస్లో ఉన్న వాటిని మీరు ఫోకస్ చేయాలనుకుంటున్నారు?
So we should focus on preventing people from getting this disease. And we can learn from each other. I mean, so sometimes it's as simple as what we eat, right? So diet and nutrition. So when I come to India, it's amazing, right? Because what I eat, it was on a farm yesterday, and now it's in my kitchen today. In the US, we don't have that. Maybe it was on the farm 1 month ago. 1 month later, it happens in my kitchen. So we need to do a better job of access to healthy food. So that's something that we can learn in the US from India. So there's lots of things that we can improve on together. One, nutrition, as I mentioned, right? We should eat mostly a plant-based diet. So a plant-based diet means less meat. But then there's other parts, like something simple, like sleeping for 7 hours per day improves our health, right? Exercise for 30 minutes per day can improve our health. So those are the kind of things that we call lifestyle medicine, so that we can improve our health, not just waiting till we get sick, eating properly, sleeping properly, not smoking, minimal alcohol, social interaction. These are all the things that make us healthy. This is a lifestyle change.
టెక్నాలజీ పరంగా చూస్తే ఇండియాలో ఉన్నటువంటి మెడికల్ కేర్ సంబంధించిన దాంట్లో టెక్నాలజీ, డిసీజెస్ ఐడెంటిఫికేషన్ కానీ వానుకున్న టెక్నాలజీ ఎలాంటివి ఉన్నాయి, అమెరికాలో ఏ విధంగా ఉన్నాయి, ఈ రెండు కంట్రీస్ మధ్య ఎలాంటి టెక్నాలజీ ఇంప్రూవ్మెంట్ కోసం మీరు ఎలాంటి సలహాలు?
So I mean, it's important to improve technology, and so I think India is an amazing place for that, right? The engineering knowledge we have, the brilliance of the students that I see, the graduates that I see, technology is amazing in India. Technology is also amazing in the United States. So it's good to share that knowledge, right? When I come here, when I go to Hyderabad and I see all of the same buildings and Google and Microsoft that we see in the US, that's amazing working together on that technology. But what I don't see enough in the United States, what I don't see enough in India, is prevention of disease. I think we all need to do a better job of eating properly, exercising properly, preventing disease. Blood sugars causing diabetes, right? Obesity causing heart attacks, diabetes. These are all 100% preventable problems. And if we don't prevent them, people will die, people will get sick, and we'll spend too much money. So AI and technology is wonderful, but it doesn't take cutting-edge technology to preserve health, to eat the right way, to exercise. That doesn't require technology. That requires a change in how we think. So that's what needs to happen.
రెండు దేశాలు ఎలాంటి లెసన్స్ నేర్చుకోవాలనుకుంటారు? ఎలాంటి అవగాహన అవసరం?
Yeah, I think this has to happen with conversations from the doctors. The doctors lead the care in our country. Help patients understand, spend time, because when somebody see me, I'm an E.N.T. doctor. If they see me, I'm looking in their mouth, I'm looking in their ears, I'm diagnosing infection, I'm giving them an antibiotic. That's the standard appointment. Hardly any time is spent preventing disease, right? So we should have a conversation with our patients saying, oh, I noticed you're 15 pounds overweight, 7 kilos overweight. This is what I think you should eat. This is what I think you should do. You will be healthier. That conversation never happens. But if it does happen, then we will end up being a healthier country.
H1B వీసాలకు సంబంధించిన దాంట్లో మీరు కొంతవరకు ఆందోళన చెందారు. అలాగే 2026 నుంచి 2030 ఇంకా తర్వాత పోతే డాక్టర్ స్కేర్సిటీ అనేది చాలా పెద్ద ఎత్తున రాబోతుంది. దీన్ని అడ్రస్ చేయడం ఎలా అంటారు?
The H1B visa is amazing. My parents, Amma Nana, ikkadi nunchi vacharu. They came to the USA. It wasn't H1B then, but the same thing, right? And the USA welcomed them to come to help to take care of them. Now, if you have an H1B visa, then you have to spend $100,000 just to come to the USA. And so that's a problem because we don't have enough doctors. So we need more doctors. We need more international medical graduates. And so we have to fix that problem with the H1B visa having a $100,000 bill. So that's why the A.M.A. has spoken to people in the White House, has spoken to the President's department that's focusing on this to see if we can get an exemption so doctors won't have to pay $100,000 to get an H1B visa.
అంతర్జాతీయ మెడికల్ గ్రాడ్యుయేట్స్ కి ఎలాంటి కోఆపరేషన్ అవసరం అంటారు?
So I think this is a wonderful opportunity to use the brilliant minds, the highly intelligent doctors. When they have that training, they should be able to come to the United States to help with the healthcare in that country. So one of the problems is the H1B visa, but one of the other problems, the residency program. So if I'm here in Vijayawada and I'm an E.N.T. doctor and I do ear surgery for 10 years and I'm wonderful doctor. If I go to the United States, I have to restart day one, spend another 5 years, and then begin to practice. So there's many states in the U.S. now that say if you already have that training, you don't have to start the training again when you come to the U.S. You can keep going based on the training you already have. So that's another solution.
A.M.A. యాక్టివిటీస్ అలాగే డాక్టర్స్ తాలూకా స్కేర్సిటీ వీటికి సంబంధించి వారియర్ ప్రోగ్రామ్ మీరు ఆలోచిస్తున్నారు. దాని తాలూకా వ్యూహం ఎలా ఉండబోతుంది?
Many times to improve the healthcare needs more than just the doctor. It needs the nurses. It needs the other therapists, physical therapists. It needs the people that make the law about healthcare. So everybody has to work together to be able to do this. It can't just be just the doctors because the challenges are too high. Everybody that's involved in healthcare, from the government to the doctors to the nurses to the therapists, we all have to work on the same goal of creating a healthier India and, as the American Medical Association, a healthier America by having everybody cooperate and focus on the same goal instead of each having their own individual goals.
టెలిహెల్త్ సంబంధించి చాలా వరకు ఫ్యూచర్ ఏ విధంగా ఉండబోతుంది? రూరల్ ఏరియాల్లో మెడికల్ కేర్ కి టెలిహెల్త్ ఏ విధంగా ఉపయోగపడుతుంది?
It's an amazing development to improve healthcare. So we used to have telemedicine even before. In the US, the problem was that if you didn't live in a rural area, you could never use telehealth and be paid by the insurance company. Now that's changed because after COVID, everybody needs to be able to get care, but sometimes they can't get to the doctor's office. So now telemedicine is covered, and that's what the American Medical Association is trying to make that a permanent solution, because if you live in a rural part of India, it's amazing to get access to a computer screen and be able to have a doctor's appointment. But in the same city, right, the same country, if you live in Hyderabad and it takes 90 minutes to get to your doctor, that's a problem also. But if you can just open your computer and talk to your doctor, whether you're in Hyderabad or whether you're in rural India, if you have the same access by not having to drive either 100 miles or 2 miles in 90 minutes, you have better access to care. So it's going to be wonderful to see how we can improve healthcare by using telemedicine.
2030, 2036 వచ్చేసరికి డాక్టర్స్ కొరత ఏ స్థాయిలో ఉండబోతుంది? చాలా మంది ఓల్డ్ ఏజ్ లోకి వెళ్తున్నారు. దీని ఇంపాక్ట్ ఎలా ఉంది?
Yeah, it's going to be a big impact. So in the United States, we have almost an 85,000 doctor shortage by 2030. So we don't have enough doctors. So we have to open the residency program in the U.S. because we have medical students, but we don't have enough residency programs. So we have to increase the number of residency positions to solve the shortage problem. So that's we're very much trying to do that. And here also, we have a physician shortage in India. So that's why I think medical schools are important to have more residency positions so people can get the care they need.
డాక్టర్లపై ప్రెషర్ పెరుగుతోంది, కొంత బర్న్అవుట్ ప్రాబ్లమ్స్ లాంటివి ఉన్నాయి. చాలా మంది మెడిసిన్ ఫీల్డ్ ను కూడా వదిలేసి వెళ్ళిపోతున్నారు. దీనికి ఏంటి రెమెడీ అంటే?
The cause of the burnout is different for different doctors. When you add them all together, 50% of doctors are feeling burnt out. They want to stop their practice. They want to stop their job because so much anxiety watching. So because of that, we have to deal with the causes of burnout. Sometimes it's insurance companies. Sometimes it's the hospital where they work. Sometimes it's the amount of the financial difficulty based on how many patients they see, how much the insurance company pays. All of these things cause people to say, I'm done, and they leave. But that causes a problem for their patients. Patients have to find a new doctor. There's not enough doctors. So we have to make sure that doctors are happy, satisfaction, doing their job, so they don't quit their job.
ఇప్పుడున్న ఈ ప్రాబ్లమ్స్కి గవర్నమెంట్ పాలసీ సరిగా అడ్రస్ చేయలేకపోతున్నాయి అనుకోవచ్చా?
In the US, for example, if we have a problem with an insurance company, if our anger, insurance companies won't change anything. So we have to go to the government to ask them to help us solve this problem. So the important thing is to have a good relationship with people that can help us if the company itself doesn't want to help us. So both are important.
కాస్ట్ బాగా పెరిగింది, అలాగే వైద్యం కూడా ఒక వ్యాపారంలా మారిపోయింది, ఒక సర్వీస్ నుంచి ఒక బిజినెస్గా మారే పరిస్థితి ఉంది. అంటే దీనికి ఎక్కడ అడ్రస్ అవుతుంది? కామన్ మ్యాన్ ఎఫోర్డబుల్గా వైద్యం రావాలంటే ఏం చేయాలి?
In the US, and I'm sure it's the same in India, when the cost keeps going up and we need help with that problem, so patients can still get health care without worrying about the cost, the best solution are the people that make the law. So I think then, when I talk to the lawmakers, when I talk to the senator, when I talk to the House of Representatives in the US about access to care and the cost of that care, we focus on making sure that we spend that money properly. So for example, if there's so much paperwork costing money, instead of taking care of patients, we need to decrease the paperwork. We don't want to be busy on a computer typing instead of looking at our patient. So we can improve the access to care, we can decrease the cost of that care by focusing on patients instead of the bureaucracy of the electronics of documenting that care.
ప్రెజెంట్ సమాజంలో ఎక్కడ చూసినా సరే చాలా మంది టెన్షన్తో ఉంటున్నారు. సైకలాజికల్గా టెన్షన్, వర్క్ టెన్షన్, ఇవన్నీ. అసలు ఇంత టెన్షన్ ఎందుకు పడాల్సిన పరిస్థితి వస్తుంది? దీని నుంచి బయటపడాలంటే ఎలాంటి జాగ్రత్తలు తీసుకోవాలి?
Mental tension or mental health is something that we don't spend enough time taking care of. We're very good at physical health. If I have a lump in my neck, we're very good at taking care of that lump. But if I have anxiety in my brain, we're not very good at taking care of that. So I think we should focus on taking care of people that have any sort of tension or mental health issue. But part of it is prevention of that mental health issue. And that's where I learned a lot from being Indian. So I grew up, my parents are big followers of Swami Chinmayananda. So since I was a little kid, we used to see Swami Chinmayananda, we used to go to the lectures, we used to go to the camps. So I learned a lot about Vedanta. And I think Vedanta is important because we preserve our physical health by living properly, by eating properly, by having good mental health, and we are healthier because of that. So I think that kind of study of Vedanta can help us with our mental health, less tension, less anxiety, that will improve our physical health.
సో మెంటల్ హెల్త్ తాలూకా ఇంపాక్ట్ ఫిజికల్ హెల్త్ మీద ఎలా చూపిస్తుంది?
So for example, when you look at them that feel confidence, they feel happy, they're excited to treat their cancer, they will survive longer. But if there's tension, if there's anxiety about their cancer, and they don't have that good mental health, their survival is less. So there's definitely a connection between mental health and physical health. You need good mental health to live a good physical health.
ఈ టెన్షన్ వల్లే హార్ట్ ప్రాబ్లమ్స్ కావచ్చు, లేకపోతే నిద్ర లేకపోవడం కావచ్చు, డిప్రెషన్ కావచ్చు, ఇవన్నీ బాగా పెరుగుతున్నాయి అనుకోవచ్చా?
Yes. Oh yeah, definitely. Because I think we are so focused on taking care of our physical health, and when we don't focus on good mental health, then our health suffers. In the US, for example, the life expectancy, how long will we live, right? It becomes stagnant. It should go up all the time. We should live longer than our parents. We should definitely live longer than our grandparents. But if the tension is causing us not to live until we're 80, not to live until we're 90, instead to die when we're 70 because of tension, that needs to be worked on.
సో ఈ మెంటల్ హెల్త్ ప్రభావం ముఖ్యంగా ఎవరి మీద ఎక్కువ ఉంటుంది సార్? అంటే యూత్ మీద ఉంటుందా, చిల్డ్రన్ మీద ఉంటుందా, ఓల్డ్ ఏజ్ పీపుల్ మీద ఉంటుంది, ఎట్లా ఉంటుంది అసలు, ఏ విధంగా ఉంటుంది?
Everybody. So we see the childhood suffering from mental issues. And it may be a different type of mental problem. Even in the seniors, the oldest among us, the suicide rate is very high. So it infects everything from children to our grandmother and grandfather and everybody in between in different ways, but there's a mental health consequence for everybody.
ఇప్పుడు కొత్త రకం డ్రగ్స్ వస్తున్నాయి, చాలా వరకు యాంటీబయాటిక్స్ యూసే చాలా పెరిగింది. సో ఈ పరిస్థితి నుంచి వైద్య వ్యవస్థ ఎలా ఎదుర్కోవాలి? పేషెంట్కి కూడా సైడ్ ఎఫెక్ట్స్తో చాలా రకాల అదర్ డిసీజెస్ వస్తున్నాయి. దీనికి రెమెడీ ఏంటంటే?
We need to be smarter about how we use our antibiotics. So if we use too much antibiotics, and that's a problem. If somebody sneezes one time, they get an antibiotic. 70% of that time, it's a virus, not a bacteria. They don't need an antibiotic. But if we give them an antibiotic, then the bacteria becomes more resistant. So we need more antibiotics, and it becomes harder and harder to get rid of that infection.
2024లో మీకు బ్రెయిన్ ట్యూమర్ వచ్చింది, మెమో క్లినిక్ జరిగింది. దీంట్లో మీ ఎక్స్పీరియన్స్ ఏంటి?
It was an amazing experience. November of 2024, I was giving a speech and I wasn't speaking properly. Everybody thought I had a stroke. So I got an MRI scan and I had 8-centimeter tumor here on the left side of my brain. So I had surgery and they took out 90% of the tumor. They couldn't remove all of it, but the average life expectancy is at least 10 years. So I'll be alive for at least 10 years, maybe more. But at the beginning, it was very much anxiety. My mother and father, nobody wants to lose their child before they die. And so it was distress. But then I realized in the United States, as the president of the American Medical Association, within 1 week, I was able to find a surgeon. Within 1 month, I had my surgery. And now 1 year later, I'm talking to you, but that's only possible because of that technology, because of the access. Not everybody has that access. If I grew up in a poor neighborhood in the United States, if I grew up in a poor suburb or poor area of Vijayawada, I would never have this access to care. So then I realized that if this happened to me, it's not by accident. Somebody up there, whether it's Krishna, whether it's Jesus, I don't know. But somebody had a plan so that I could go through this. They keep me alive. So now when I speak about healthcare in the United States and the world, I do it from not just a doctor's perspective, but from a patient's perspective because I was a patient. So it was amazing preparation and I'm happy to be alive.
మీరు యాజ్ ఏ ENT డాక్టర్గా కాకుండా చూస్తే మీరు లాస్ట్ ఇయర్ మూవీస్ సంబంధించి ఇండియా రావడం జరిగింది.
Didn't have any interest. It was a coincidence. It was an accident. We came to Hyderabad and when I was there with other A.M.A. board members, somebody asked me to be in a movie. And he was a very nice man. He was a producer of the movie. I thought he was joking, but he wasn't joking. So then I came back in a few months in March of 2024 to be in a movie called Hulla Gully. So it hasn't been released yet, but I stopped my E.N.T. job for 9 days and then I played a British tax collector in this movie Hulla Gully. And I realize now that I have zero talent as a movie actor, but I did it once for fun.
సో దీన్ని మళ్ళీ కంటిన్యూ చేస్తారా? ఏమైనా ఐడియాస్ ఉందా మూవీస్?
If somebody sees it and they think that my acting job was good and they want me to do it, I would consider it. But if I have a brain tumor and I have 10 years to live, then I think there are other things I need to do in that 10 years, not just being a movie actor.
థ్యాంక్ యూ సార్.
Thank you.
ఇది డాక్టర్ బాబీ ముక్కామల గారి మనోగతం. విజయవాడ నుంచి కెమెరామెన్ భాస్కర్తో శ్రీనివాస్ మోహన్, ఈటీవీ న్యూస్.